These signs that I'll be posting will be seen at the park, and these signs will be posted one in and around the shelter houses, and one in or around the area where the kids play, the playground area, swing set area, and so understand that these are just signs for awareness. Um, you can't be in trouble for disobeying them, as far as I understand it. So here is my interview with Lesa Garey from the Perry County Health Department. Lesa did not want to be on camera. I did not communicate with her uh, well enough to let her know that I wanted to do an on-camera interview. So the video you see will just be of me talking with her, and the audio will be me and her. For the video, you'll just be seeing me. So forgive Lesa for not wanting to be on camera. She was not prepared for that. That was my fault. And for more information about this, because the subject here will be secondhand smoke and no smoking areas in the park area, so I will leave a link for more information. During this interview, she describes the free help that's available to residents of Perry County, whether that be therapy, and it's not the kind of therapy they might think of. So it's, we'll get into that during this interview. We are social distancing, and since we were more than 10 feet apart from each other, we felt comfortable taking our masks off for this interview. So that's something I had set up prior to her being there so that we could maintain social distancing and not wear masks. These signs are not policy, they're not law, they're not enforceable, they're just awareness signs. So no need to be really upset about them being there. We're just hoping that people obey the signs by not smoking around others, be courteous, be kind, that kind of thing. Contact information, I'll be posting that as well. So here is my interview with Lesa Garey from the Perry County Health Department. Thank you. First off, I'll introduce myself with Kirksville News. My name is Rocky Chevalier, and you are?
Lesa Garey from the Perry County Health Department.
Alrighty. What do you do with the health department?
I work on a tobacco use and prevention and cessation program, and also vaping with youth involved. So I try to prevent youth starting tobacco use, and I also work on preventing secondhand smoke exposure to everybody in the county, and offer cessation program and nicotine replacement therapy for anybody that wants to quit smoking.
Okay. What got you into this kind of work?
Well, okay, so I worked for 20 years in the juvenile justice system, and I did what was called a personal responsibility education program with kids in that facility that I worked in.
Right.
Then the position opened up at the health department for a coordinator for that position within 11 county area, and we partnered with other counties too. But I did the personal responsibility education program in Perry, Morgan, Muskingum, and Coshocton County with kids involved in the juvenile justice system. And basically what it was is a life skills program in preventing STDs and making good choices and that kind of thing. Then it was presented to the health department. The Ohio Department of Health had a tobacco use prevention program that was in the beginning geared a lot around the youth.
Mm-hmm.
And so they asked me to take that position also. So I did. So I worked on both grants.
Mm-hmm.
And then the personal responsibility education grant went more over to Nationwide Children's Hospital. And then COVID happened and we couldn't get into the facilities anyway. So I don't do that anymore. I just do the tobacco use prevention, cessation, and vaping.
Secondhand smoke, I took for granted because I thought everybody knew what it was. And I've spoken to a few people around Kirksville that I would assume would know what it is. So could you define what secondhand smoke is?
Well, secondhand smoke is anything that comes from somebody else smoking. The secondhand smoke is like if you were smoking and your smoke is going, that's secondhand smoke to me. Now, if I go home after being around you, and I smell like smoke, I am exposing to third-hand smoke to somebody. Same way with if you're a smoker and you say you smoke a cigarette and then you go inside and you're not smoking, but the smoke is still on you and you hold a baby, you're exposing that baby to third-hand smoke. So there's still a
component.
Yes, in it.
Okay.
But secondhand smoke kills 41,000 people a year. I'm working with a lady now that has some lung issues, and she's never smoked, but the doctor said that she has some lung issues from being around smoke all of her life.
Oh, wow.
As she was growing up, her parents smoked, her husband smoked, her kids smoked, and so now she's dealing with some lung issues from secondhand smoke. And she is the first person that I've met that has had an actual illness from, that the doctor has said was from secondhand smoke.
Wow. How bad is it as compared to like third hand, second hand versus someone who smokes directly?
Well, exposure to secondhand smoke is the leading cause, another leading cause of preventable death. 1 in 4 non-smokers, that's 58 million people in the U.S., are exposed to secondhand smoke, and it kills more than 400 infants and 4,100 non-smokers each year.
Wow.
Because smoking in your house is one of the things that causes SIDS. So
I've seen that in the paper. Yeah.
And
how are those numbers put together? Any idea?
There's statistics and data. Everything's reported. So
is it like seen as a number one contributor amongst those people, or is it just amongst like a top 3 things that may be going on with their life, or how is that? Any idea?
Well, some of the things. One is what you're talking about with the kids, with babies.
Well, anybody with secondhand smoking.
Well, they would do, just
over like a life analysis,
Yeah.
kind of thing, and then from there they have the other data compiled with that.
Yeah.
Then it's a way of putting a number together.
Yeah.
Okay.
It would be like they would interview, okay, so, babies that sleep alone on their back
Oh, okay.
are, the best prevention to SIDS. No smoking in the house. And it causes more ear infections, sinus infections, and that kind of illnesses among kids as they're growing up, if there's a smoker in the house. And, the way they do that is when you go to the doctor, and you have a constant ear infection, they're going to want to know, is anybody smoking in the house? Is this?
So amongst the population, a common denominator could be exposure.
Yeah.
Oh, okay.
Yeah.
That makes sense. Some of these may be somewhat redundant, but I'm just curious because I know it'll be asked to me at one point in time. At what distance would one be affected when it comes to secondhand smoke?
Okay, I have a technical answer for that. According to the Surgeon General,
Mm-hmm.
so that's according to a leading secondhand smoke expert, secondhand smoke levels in outdoor public spaces can reach levels as high as those found in indoor facilities where smoking is prohibited or permitted. Secondhand smoke odor is detectable at 23 feet from the surface or from the source. I'm sorry. And irritation levels begin 13 feet from the source. So anyone positioned downwind from an outdoor source of secondhand smoke will be exposed, even at significant distances from the source. So in 2006, the Surgeon General's report concluded that there is no risk-free level of exposure to secondhand smoke. So it's detectable 23 feet from the source, and if the wind's blowing in your direction, then it's even further.
So what is the 13 feet irritation? What's that?
That would be if it causes, well, I don't know if you've been around a smoker and you're like,
Okay, that
that-
type of thing.
yeah,
That makes
anything
sense.
that irritates.
Okay.
And even smelling it would be an irritation.
Mm-hmm.
I know if you walk down Lincoln Street in New Lax and you get, so going down Lincoln Street, you have the whole side building of Kroger's,
Mm-hmm.
and then it goes that way. When you get about halfway on the side of the building, you can smell cigarette smoke from the employees that are smoking in the front of the building at their picnic table.
Oh, okay.
Because we will walk that sometimes, and you get about right there, and if somebody's out there smoking, you can smell it. And that's clear around a building.
Right.
So,
All right. Is secondhand smoke the same when it comes to how it affects kids and adults?
well, you're going to see more illnesses that they have data for in kids. The ear infections especially is one of the things, sinus infections.
Is it just
colds.
because they're just more vulnerable? They're developing that kind
Yeah,
of thing?
their kids are still developing and still growing. Their lungs are still developing, and
Okay.
they're breathing that, and it's going in their bodies, and so yeah, it's
Okay.
because they're still developing.
All right. And how about animals? Are animals affected with secondhand smoke?
Yes, they are. Your vet will usually tell you. Now, I'm not real knowledgeable on what, but they do say that secondhand smoke affects your pets.
Okay.
But I'm not real sure how.
Mm-hmm.
But I know that they do say it does.
It's probably to some degree more complicated because of different breeds, and certain breeds are more susceptible.
Yeah,
Yeah.
maybe.
Okay. All right, and let's see. What are some methods used by the health department and yourself to help spread awareness about secondhand smoke?
Well, one is people like you getting in contact with media sources. We do advertising on radio. Perry County is very limited on what kind of media we have exposure to. We have the Tribune, and we have one radio station that I'm not sure how many people listen to.
Right.
And then we have one of the things, before COVID was we were trying to partner in this and using your media, your Facebook stuff that you do, and to help advertise. The health department has a Facebook page that we put information on. We go to meetings, coalition meetings, township meetings, council meetings.
What is a coalition meeting?
A group of people that get together to make decisions on something.
Almost like a think tank in a way.
Yeah.
Okay.
Yeah, that's a coalition. The Think Tank on Poverty is a coalition.
I've been in contact with them here recently, but
Yeah.
yeah. All right. You're wanting to place signs at our park. Why? What will it say?
Well, what I would like for it to say is no smoking in the shelter house. I know that when I was at the council meeting, that Tom did say that he would like to have some signs for the shelter house so that people are not smoking in there and using tobacco in there, and the restrooms, because he doesn't want people going in the restrooms. And I mean, when you think about it, you work hard for your shelter house and your restrooms and your parks to be nice for people. And if you've got people and they're smoking in them or using any tobacco, spitting on the floor, you know, throwing their cigarette butts on the floor, the restrooms, you know, if you go in them and they smell like cigarette smoke, that's exposing people to secondhand smoke when they go in because it's still in there.
Right. And when it comes to financially, someone's got to
Clean
clean
that
that
up.
up, and that comes from the taxpayer.
Yes.
Yeah.
Yes. And one of the things that we work with recycling too on is the litter from cigarette butts.
Mm-hmm.
And we're and actually I have one of these butt containers at my office. If they wanted to put it up in the park, they could, because some places recycle cigarette butts. 15,000 cigarette butts will make a park bench.
Wow.
Now, you know, you have to find a company that will take them and do it. And right now, recycling is, I don't know if they have found somebody yet, but I know Athens County has somebody that takes them. So, like New Straitsville has the butt containers, and Shawnee does, and they collect them all, and they take them and give them to somebody in Athens County. And Athens County has a way to get those recycled. And they don't do it in Athens County. They know a company. I know there's a place in New Jersey that does it.
Oh.
And then there is some money attached to it that you have to pay them for doing it.
Right.
But they can make park benches with 15,000 cigarette butts.
I used to smoke. I smoked for 9 years. And at the time, it was always seen as, oh, just a little. But I could see how that, you know, if you just think about it, obviously it adds up.
Yeah.
And eventually someone's going to have to pay for either the cleanup or however that's. I don't know what happens to a bud after a period of years. I have no idea.
It stays for a long, long time.
Yeah, I would imagine.
I
don't know what a bud's even made of. Any idea what it's made of? I know it's slightly off topic, but anyway, but is it cotton or something? Or, I mean, what is that?
I don't know.
No idea. I have no idea either.
I probably have known in the past and my research have seen it, but
yeah,
because the tobacco companies, they change things all the time to make you think that it's not bad for you, but
right.
it is.
Well, they got something to sell to you, of
yeah.
course. Yeah. Now, where all in the park are you wanting to put signs?
Well, particularly the shelter house and the restrooms, because that's where council wanted signs for sure. I would like to put one by the swing sets, so that people are not smoking when the kids are playing on the swings. My ultimate goal is for the entire park to be tobacco free.
Right.
For a couple reasons. One, so it can be tobacco free, and so that kids know that tobacco use is not acceptable behavior.
Right.
You know, if they see adults in the park using tobacco, then they're going to think it's okay to use tobacco, and they're going to think it's okay to use tobacco in the park.
Right.
Because the adults are doing it.
Yeah.
But what I'm trying to do also is to get tobacco-free school campuses in Perry County. Right now, Northern Local is 100% tobacco-free campus.
What does that mean exactly? Like, is that just like teachers and students, everybody?
Anybody that comes on.
The janitor, everybody?
Yep.
Oh, okay.
Salesman, everybody it's tobacco-free. Ball
Now,
games.
what's the difficulty about getting that done?
Because schools want designated smoking areas for their sporting events.
Oh, okay.
Because
sports is a hard thing to fight. I understand that.
But it doesn't affect your audience.
Yeah.
You know, anybody can go to a ball game for 2 hours and not smoke or rub snuff or chew tobacco or
Right.
you know, You're just giving them the option to do it.
Yeah.
And if they're rubbing snuffer chewing tobacco, they're spitting it on the seats and on the bleachers, and we're, I mean, you know, it's kind of gross. And with COVID right now,
Yeah.
I don't want anybody spitting around me.
Not really, no.
You know, and so at the time, Matt Sheridan was the superintendent when I first started this particular project at Kirksville.
Mhm.
And he said, if you can get council to make the park tobacco free, then we'll talk about a tobacco free campus, because the football field being over there.
Mhm.
Because, and I haven't talked to the new superintendent because
Yeah.
COVID, it's,
I think it's Kevin Smith or something. Yeah.
yeah. So, Matt was under the impression that he couldn't make his campus 100% tobacco free because he didn't own the football field. Even though the school leased it,
Mhm.
they could still do a 100% tobacco free campus and not allow people to use tobacco within the football
Right.
stadium area.
Mhm.
But he felt like the park needed to be tobacco free before he could make that decision. So I came to council to try to get the council to consider tobacco free, so that I could get kind of two things done. One, the park tobacco free, and two, the school campus
Right.
tobacco free.
Hmm.
And like I said, I haven't talked to the new superintendent yet, because of COVID and because, you know, he just kind of took over in August.
Yeah, I'm sure
and-
he's got a full plate.
Right.
Yeah.
All the schools do right now with COVID and
Right.
and everything. So so that is where I got started on the Kirksville Park, my first outdoor space project.
Right. See how quickly it got smashed.
Yeah.
Alrighty. Alright, signage. Will that cost me money as a Kirksvillian?
No.
How's it paid for?
Ohio Department of Health provides us grant dollars to use in our communities for things like that.
Okay. Where can I go to learn more about this specific issue on secondhand smoke?
The health department. We have lots and lots of information. Right now I'm working on a vaping task force in Perry County to try to get enough people together to talk about different strategies for preventing youth from starting vaping, because you know that vaping is just went crazy with the youth in the last couple of years.
Now I know next to nothing about vaping. Is it comparable to cigarettes?
It's almost like it.
Oh, really?
They started the vaping and the e-cigarettes, the tobacco companies did,
Mm-hmm.
to convince people to use that as opposed to.
Traditional.
Yeah.
Yeah.
But what it is there's still nicotine in it. But tobacco companies don't have to advertise that there's nicotine in their vape products if there's less than a certain percentage, like 0.5 or 0.05%
Oh, okay.
nicotine. They don't have, so they can advertise it as nicotine free.
Right.
Any amount of nicotine will addict you.
Is that why nicotine's bad? Is because it has
It is
addictive qualities?
the most addictive.
Oh, okay.
Nicotine. The nicotine is not what is in the cigarette that hurt you.
Mm-hmm.
There's over 7,000 chemicals in a cigarette. 60 of them are carcinogens that causes cancer. The nicotine is put in the cigarette to addict you so that you'll continue to smoke it.
Oh, okay.
So it's an additive to get you to use the product so that you'll continue to buy them. Now,
So it by itself would not be necessarily bad. It's how it's used, right?
yeah.
Okay, that makes
But
sense.
nicotine is the most addictive drug that there is. Which,
Oh.
you know, you think when people are using any kind of drugs, but they still use their nicotine, it's
Mhm.
harder for them to quit that. One, because it's legal,
Right.
you know, and two, um, which is another thing that I'm working on, is getting our mental health and addiction services in Perry County to have their campuses tobacco free. You know, because it's a good time for them to quit the tobacco is when they're quitting everything else.
Yeah.
You know, just stop all of it. And there's no evidence that if you quit tobacco while you're quitting other drugs, that you'll go back to other drugs or tobacco.
Oh, okay.
Actually, the data shows that you're more apt to relapse if you don't stop using tobacco. So that's some of the things that we're working on too, is trying to get the mental health people involved in getting their clients to quit using tobacco.
What kinds of treatment are available in your Perry County?
Well, Perry Behavioral Health offers cessation. All Well, Genesis, the health department, we all offer cessation, which we offer the counseling along with the nicotine replacement, which be your patches or your gums, instructions on how to use them, and those kind of things.
And the idea behind the patches and gum is to give you the nicotine, correct?
Yes.
But yet disconnecting it from the things that are attached to it traditionally.
Yes.
Right?
Yes.
Okay.
And nicotine replacement alone is, you have a higher relapse rate if you get the counseling with it, because nicotine addiction is both physical and psychological.
Right.
So, you know, you need counseling to redirect those psychologicals, if that makes sense.
Yeah, I've never had counseling, so I don't know.
Yeah, it would
but,
be.
But for example, when I was going to quit cigarettes, I quit in 2009. It took me 3 months to consider it mentally. And once I was like, okay, I was like, there was no unconvincing me. Once I had decided, and I purposely quit half pack to prove to myself that I was strong enough to do it. Because if I quit half pack, then I'm good.
Right.
Because everybody wants to quit when they're done.
Yeah.
You're not done when you're done. You know, yeah.
Right.
I've seen that happen.
Right. And, you know, those psychologicals is, you know, like a lot of people are triggered as soon as they get in their car.
Yeah.
They want to smoke. So the counseling part of it is just to talk about alternatives, what you can do instead.
Okay.
They call it counseling, but it's just kind of like some motivational stuff.
Right.
To say, well, you know, when you get in the car, how about if you do this? Or if you want to quit, how about you make your car smoke-free first? How about you make your house smoke-free first?
Yeah.
You know, do those little steps, give them other suggestions. If you always sat on the porch and smoked, maybe you don't want to sit on the porch for a couple days. You
Right.
know, that kind of thing. Sit somewhere else where you didn't usually sit and smoke.
Right.
So those kind of things.
If you can't break the habit, change the habit,
Yes.
kind of a thing.
Yeah. Yeah.
That's another thing I learned is just because you quit smoking doesn't mean you're good, because I adopted Doritos and I had to gain some weight because of it, you know.
Right.
So, yeah, and I know that's common. I've read about that, so I'm
Yeah.
aware it's common. But by quitting the habit of throwing something in your mouth or your face or whatever,
Right.
that's a difficult one. So I've seen that. Yeah, struggle with it.
Yeah, and you know, and if you have friends that use tobacco,
Yeah.
and every time you're around your friends, you know, they're using tobacco.
Right.
You know, so it's good to let your friends know that, you know, I'm really trying to quit. So,
Right.
you know, but then there are some friends that'll continue to try to get you to use the tobacco
Well,
product.
sure. I'm sure
anyway.
half of them are probably scared to smoke alone.
Yeah.
Yeah. I drive truck for a living, and so it was difficult. But like I said, that 3 months, I was really determined to see if I was mentally strong enough, because that's one of my insecurities. I always feel like I'm not smart enough, which is fine, whatever. I deal with it. And then my latest co-driver, I drive team, he came into the truck smoking, and he seen it as an opportunity to quit, because he couldn't quit, if he's around other people who's always smoking. And he's been now smoke free for
Good.
6 months.
Good.
At least 6 months. Might be more close to a year. But yeah.
Yeah, that's good.
So I could understand how the environment would change.
Yeah.
And that's what you're talking about. Like if you smoke on the porch, changing how you go to the porch or where you sit or what you do.
Right.
Yeah. All right. Let's see. In regards to signage and how Crooksville sees these signs, I want to talk about that and so that people have an understanding what these signs are meant for. So these signs will be adopted as a policy. What is policy?
Well, first of all, the signs that I told the council that I would provide doesn't have anything to do with policy.
Oh, okay. They're just awareness signs.
Awareness.
Oh, okay.
Yeah, because they choose not to be tobacco free. Now, because they don't want people smoking in the shelter house, and the bathrooms is actually an enclosed building, so you're not supposed to be smoking in there anyway.
Mm-hmm.
But you know, with the shelter house being open all the way around at the top, they could get away with smoking in those, and so the council just wants people not smoking in certain areas.
Mm-hmm.
So there would be no policy for those. But policy just is, there's an actual definition for policy, but my definition is just saying how something should be and
Okay.
is going to be. It's not law,
Right.
you know. There's difference in policy and law.
Is there any way that it could be enforced?
Enforcement comes through advertising, signage, and really your neighbor just saying, you know, if you're in the park smoking and I said, hey, this is tobacco free park, you know, that kind of thing.
Mm-hmm.
But not to an extent where you would get yourself
Right.
in a truffle with somebody. But
Yeah.
really your enforcement is your advertising, your signage, and stuff like that. Announcements, like it would be if Crooksville decided to go 100% tobacco-free parks, then they could put a statement on your Facebook, you know,
Mhm.
Crooksville News. Crooksville Park is tobacco-free. Please adhere from using tobacco products in the park. Those kind of things is enforcement. When people hear enforcement, they think somebody's out there policing
Right.
the area. And then there are some people that say, well, if you're not going to police the area, then there is no enforcement. Then why do it?
Right.
Because somebody will not smoke in the park.
Right.
You know, it's like these masks. Nobody's out policing that.
Right.
So, but that doesn't mean that it's not a mandate.
Right.
You know, so
It also shows that you don't have to be policed for a large percentage to participate.
exactly. It
And
doesn't have to.
Although your goal may be completely tobacco free or everybody wearing masks, you wear masks, that's a long term goal.
Yeah,
Okay.
yeah.
All right. Well, we already covered that one. Let's see. All right. Here's one I could see someone saying to me. So, I smoke at home around my kids. Why should I care about this? I know we somewhat touched upon it earlier when it comes to smoking, like in the restrooms, whatnot. But
So
what could you say to someone who? I know you can't convince somebody who's like hard set against whatever the idea is. But is there anything at all that you respond to something like that?
one of the things is that I don't really know that anybody would say I smoke at home around my kids, and because most people do have a conscience about that. You know, if
I would hope so, but I know
Yeah.
people. That's the problem.
yeah.
Yeah.
And I would probably just say, well, you know, you really shouldn't smoke at home. around your kids, because people say they have a right to smoke. People don't have a right to smoke. People have a right to choose what they do.
Mm-hmm.
And if smoking is one of them, then that's their right to choose
Right.
their unhealthy habits. So those kids don't have a right to choose whether they smoke or not, because
Right.
you're smoking in the house, so therefore they're smoking.
Yeah.
Parents typically do not want their kids to smoke. But if their parents are smoking in their house around them,
Mm-hmm.
and that's their role model, then chances are the kids are going to smoke.
Right.
There are some that will say, I will never smoke because my parents smoked and I hated it. You've got those,
Right.
you know. But you've also got the ones that are just going to start smoking because they think it's okay, because their parents do it.
Of course.
And, you know, so, but I just don't know that that anybody would say that, and I would be stunned. So
Mhm.
I don't have a really good answer for that, other than people in the park have a choice, or have a right to healthy environment, because that is in the Constitution if you look it up.
Yeah.
You know, the right to health and health equity and
Right.
and all that. And so if somebody is smoking, you know, if I'm sitting here smoking around you, I'm taking the right to clean air away from you.
Right.
So that's why you should.
Yeah.
Because,
I don't know if anybody would say that.
yeah, you
to
want
me,
your rights
but
you want your rights respected,
Right.
or what you think is your rights to be able to smoke. But what about the people that don't want to have to breathe in your smoke?
yeah.
You know, they have a right too, to not breathe, because the secondhand exposure does affect their health.
I would imagine not too many people would say that, except for like maybe on Facebook or something like that. But where I'm coming from, that specific question would be, although someone would say to you and I, or to the average person, I would hope my kids don't smoke, but meanwhile, their actions speak louder than words. So I'm going off people's actions that I know, and I'm sure you know as well.
Right. And I can leave this information with you, so that if somebody does say something on Facebook, you can look at it and say, well, let me see, I'll find out how to answer
Well,
that.
I don't plan to argue with them on Facebook. I got like a life.
Yeah.
Let's see. Okay, here's one that we talked about a little bit before we started, but it's going to have to be addressed as well. I feel as if this is government overreach. Why can't the health department just leave me alone?
Okay, so first of all, the health department is not government overreaching. The health department is a entity that wants to give everybody in Perry County healthy lifestyle, healthy choices.
Mm-hmm.
And that includes smokers, that includes non-smokers. So we are not the government. The government's not saying, hey, don't smoke there.
Right.
It's just
Awareness signs and awareness things.
Communities
Yeah.
wanting clean air. You know, we see the debates on the news, Trump and Biden debating the environmental stuff.
Mm-hmm.
You know, and this is the same thing. It's
Right.
environmental stuff. You know, just at a lower level.
Right.
Obviously, we're not dealing with oil companies and all that.
Right. Right.
But you know, it's environmental, so it's not the government. It's just communities reaching out, asking everybody to work together and make the air that we breathe better, make the air that our kids breathe
Mm-hmm.
better.
So that would be a decent statement from the health department saying this is not some dictation. It's just us asking. Think about your fellow neighbor, man, woman, child, whatever.
Yeah.
Yeah.
And it goes, I mean, even with that, you know, that's kind of what the governor is saying about the mask. You know, if you don't want to wear a mask, you know, it's kind of, it really is that. So people don't want to wear a mask because they don't think they're going to get COVID, or they don't care if they get COVID. Well, I care if I get COVID because I have elderly people in my family that I don't want to give COVID to, that because
Right.
it could kill them.
Yeah.
It's the same way with tobacco.
Mhm.
You know, do I want to wear a mask everywhere I go? No. But do I want to get COVID
Right.
and take it home to, you know?
Well, you don't want to be responsible for giving somebody else
Right.
COVID if you were to have it.
Right.
Yeah.
And so my mask protects you from me giving you COVID. Your
Mhm.
mask protects me. So I can wear a mask,
Right.
but you can still get me COVID.
Yeah. Yeah.
Yeah, I mean that kind of thing. It's that.
It's a courtesy.
Yeah.
Yeah, more
it's
than
that
anything.
thing that.
If we're both walking on the sidewalk, it's not courteous of me to stay in the center. I'm gonna move to the side so we can both get around each other.
Right.
In the same way, you're saying, "Hey, mask, tobacco." Yeah.
Right. And if you're walking on the sidewalk and I'm walking on the sidewalk behind you and you're smoking, that's blowing back on me.
Right.
But we both got to go the same way.
Exactly.
So, okay, how about if you move over off the sidewalk and let me go ahead of you?
Right.
That's a courtesy.
It is.
But there are some communities that don't allow smoking on the streets because of the litter
Yeah.
and because of the businesses that complained that people were standing outside their businesses smoking and some people didn't want to go in.
Right.
I've met a couple that don't particularly like what I do and they're not smokers.
Mm-hmm.
And they think that people should just leave other people alone.
Yeah.
And I don't care if you smoke. I just don't want you to smoke in the parks.
Right.
I don't want you to smoke around the kids. I don't want you, you know.
If you're going to do something that's unhealthy, I would say do it on your own private
Yeah.
spot.
Yeah. I mean, you don't have to go to the park.
I don't care
to
if you
smoke.
drive a race car around the 6 mile turn track. Just don't do it on Main Street. That's what it
Right.
comes down to.
Right.
Even though I drive like that sometimes, so I'm guilty of it.
Right.
All right. Can the public contact you with questions or concerns?
Yes. They can.
Any questions for me?
Yeah, I have a couple questions. One, I'm looking for some partners in social media to post some advertisements. And what, like, I might send you something like it's like this month is it just went. Have it on my phone. This week is okay, so this week is International Stress Awareness Week.
Sounds like a stress awareness year for me.
Yeah. So, and this is what the post that we're posting is International Stress Awareness Week, November 2nd through the 6th. And then it's got a little blurb. Tobacco use is not a long-term stress reliever. Instead of picking up a cigarette, try picking up the phone as the short-term answer for a long-term solution at the quit line. And then we advertise the quit line. So it'd be like things like that. It wouldn't be things like make our park tobacco free, or it would just be awareness things. We had one last week that was National Respiratory Care Week.
Okay.
So the post just said, by quitting, you can protect not only your respiratory health, but also those around you. You can decrease their exposure to secondhand smoke and help protect their lungs. Things like that. That we look for, and that's an awareness
Mm-hmm.
thing. You know, you asked earlier how we get the word out.
Right.
You know, and maybe we might send you a picture of our cessation card to post, just telling people that if you want to quit tobacco,
Mm-hmm.
call this number, or, you know, advertising the quit line, because we do promote the quit line also, 1-800-QUIT-NOW, where people can call this number and do over the phone counseling with somebody.
Oh, okay.
Through the and it's nationwide. It's in every state. The quit line. But anyway, they do it. And it's, I don't know where they get their money.
So
to
it's
do
like an
it.
organization that does it?
Yeah,
Oh, okay.
yeah. It's a
Wow.
nationwide organization.
Now, for the services provided by the Perry County Health Department, are those free?
Yes, free.
You don't need insurance or nothing like that, right?
Nope.
Okay.
Nope. And now we can bill your insurance, and then if your insurance pays, fine. If not, fine. But we also give nicotine replacement products to people that want to use them.
Is there, don't know the word for that, stipulations, rules with having those? Like, do you need to participate in a therapy in order to get the products?
Yes.
Okay.
And so at least, okay, so when you come in your first time and we do an assessment, we want to know how much you smoke, when you started smoking, how long you've been smoking, and all those kind of things. We talk about the different nicotine replacement therapy that you can use,
Mm-hmm.
and how to use them, and which one you think would be best for you. And then we can give samples to see, we'll try this and see how this works.
Right.
Sometimes they might try the patch and come back and say, you know what, it didn't work at all. So we might try them on some gum. Sometimes we might try them on some gum and a patch, depending on how much they smoke. Doctors in the county refer people to us. If their insurance won't pay for nicotine replacement, then they refer them to the health department. And as long as each time you need nicotine replacement, I can have a 10-minute conversation with you.
Mm-hmm.
How you doing? How much you smoking? Are you doing this? Are you doing that? Then we can continue to provide. There are certain ones that we can provide, which is your Chantix and your bupropion, which is your Wellbutrin and stuff like that. Doctors have to write prescriptions for that.
Oh, okay.
We can't.
That was going to be my next question. What makes the difference with one's prescribed?
Yeah, and the things that we can supply is stuff that anybody can go buy over the counter.
Oh, okay.
That's what we can provide. We can't provide anything that requires a prescription.
Okay.
Your doctor would have to do that. Now, if your doctor does call you in a prescription and you need this psychological therapy with it,
Mm-hmm.
we can do that. The counseling part that they call it.
Mm-hmm. Is that free as well, or is that?
Yes,
Okay.
it's all free.
That's awesome. I had no idea.
Yep.
Any more questions for me?
Nope. Other than if you just wanted to do some posting once in a while, if I send you something,
Sure.
and like I said, it won't be anything that you don't want to post that you're not comfortable posting. You think your audience might.
Mm-hmm.
You pretty much know what your audience is going to have an uproar about,
Right.
And what they're.
Oh, I don't mind upsetting anybody.
Right.
I get some type of joy out of that. I think it's part of what would attract anybody to do what I do.
Right. Now you do the Perry County Press also, right?
Yes, I
You
do.
do both. Okay.
Yeah. That was the original. And then my second boy was adopting some of the habits of mine, which is, doing what we do, not making everybody happy.
Uh-huh.
And then he started the Crooksville News. And he just started it as something as a hobby because Dad's doing it. So he started it. And he just went around and took pictures of old houses, and that would be his news, Once he got up to I don't know, I'm not sure why so many people was attracted to it, but he got up to close to 600 people. And then I'm like, you want me to start putting things in there that has thought behind it? Then eventually I just adopted the dang thing.
Oh, okay.
Yeah. All right, back. One last thing. Any closing thoughts that maybe we haven't covered?
Just that when I am out, my main focus is to take the social norm out of tobacco use for our youth. don't want the kids to think it's socially acceptable,
Hmm.
that it's okay, that it's not going to hurt you, because adults are giving them that outlook
Right.
on tobacco use. So really, my fight is taking the social norm out of tobacco use. And like I said, I don't care if you choose, you have a right to choose. You choose to use tobacco, then fine. But don't make my choice.
Right.
I want to make my own choice.
Yeah. Don't make me live with any bad habits that you may have.
Right,
Yeah.
right.
That makes sense.
So.